You guys ready? This is Dr. Ichefu, your hair transplant physician, hair loss coach. I hope you guys are ready today. We are inviting our speaker today, Dr. Sodi. Let's see. I am adding her. Let me add her. Sodi. No, that's not. Give me a second. Let me add you. Come on in. She's coming in. Let's make sure she can.
Hello,
Hello.
how are you?
I'm good. Yay. How are
Good,
you?
good. Thanks for having me on here.
You good,
Yeah,
good, good, good. Thank you so much for coming on. And
of
I'm
course.
pronouncing it right, Dr. Sodi, right?
Yes, that's correct.
Good. And is Dr. Chefu or Dr. E?
Yeah, oh, perfect.
Okay.
Perfect.
Yes, thank you. How's been your week or day? I mean, it's Tuesday, so.
Yeah, well, I'm in Arizona, so it's still fairly early in the day, but it's good. Today's actually World Obesity Day, so I'm
Oh,
excited
wow.
about that. Yeah, thanks for having me
Awesome.
on today. It's quite the special occasion.
Oh, wow.
Yeah.
So, oh, wow. Okay, that's good. Okay,
Mm-hmm.
now, can you tell us who Dr. Sodi is?
Yeah, so I'm a mother, a wife,
Mhm.
a daughter, but I'm also an internal medicine and obesity medicine physician based out of Phoenix, Arizona. I have my own practice called Monarch Weight Loss and Wellness.
Mhm.
So in about 5 years ago, I used to be a traditional doctor, like hospitalist in an inpatient setting, and then I transitioned to obesity care after that because I saw the great need for this type of medicine. So I love what I do. I'm happy to be
Awesome.
here.
Awesome.
Yeah,
I love that when I hear internal medicine physicians branch into something else, like, branch into their passion. Because it
yes,
almost seems like as an internist or a hospitalist, you're like, what do I really want to do? Like, as you see patients, then I'm always happy when I see physicians, find a need and try,
yeah.
try to fill the gap and find a need to help patients or help more patients in a specific area.
Absolutely. Yeah. I think that, for some people, they enjoy that acute inpatient work, and it was definitely exciting, and I love the collaboration, but my heart was really in the health and wellness space.
Yeah.
And then when I found obesity medicine, there really was no other choice. So I think when you know, you know.
You know,
So,
you know.
yeah.
You
How
know, you
about you?
know.
When did you get into hair transplant?
Girl, it's been a whole journey. It's been a whole 5-year journey of hair transplants and
Yeah.
hair loss. Started
Yeah.
from hair loss as a patient myself.
Sure.
Started with hair loss, looking for doctors. But the thing I found out is the compassion behind hair loss. There's a lot of stigma behind hair loss. Like, I actually interviewed a doctor the other day, and she said she's never had someone, like a patient, say, if you ask them their medical history, they've never said alopecia before.
Really?
Yes.
Really?
And that kind of like, I'm like, wow, that's really, profound
Hmm.
and come to think about it, out of 10 clients, how many people have told you alopecia is a medical history?
Yeah.
You
Yeah, not
see?
very many. Yeah,
You see?
they just they
So that was it.
yeah,
Hmm.
yeah, they just deal with it.
Yeah.
So
So that was how the need came, the passion and all that came about. So
yeah,
from being a patient myself, all the treatments I had, then I wanted to help more people. Like,
sure.
take the stigma out of it. I'm like, it's okay to say you're dealing with hair loss, like,
Yeah.
but now not just stopping at hair loss. What are we gonna do about it? You know?
Right, right. I feel the same way about obesity that, up until recently, and even still, there's a stigma against talking about it, talking about the treatment of it,
Mm-hmm.
taking the blame away, the shame away.
Mm-hmm.
And Unfortunately, sometimes hair loss and obesity do go hand in hand.
Mm-hmm.
Um, we're here to talk about that
That's
today. But
right. And I'm
yeah, very
excited.
similar struggles in our populations of
Yeah.
patients. Yeah.
That's right.
Yeah.
But before we go into the question, I wanted to tell people how can they find you?
Oh,
Like,
yeah.
okay.
Yes.
Mhm.
So I see patients in private practice in Scottsdale, Arizona, and also virtually. in Pennsylvania and Georgia. And you can find me at monarchconciergewellness.com and Instagram as well. It's at Dr. Mona Sodi. So that's where people can get in touch with me and see if they want to be a patient.
Okay. Okay. I mean, it's easy to find you. At least once you're here, they're easy. They're just one click away.
Exactly, exactly. No mailing address or anything like that. It's just find me online. So
Yeah,
yeah,
fine. Now,
yeah,
the question I have is, what's the rave about GLP-1 medication? That's my
what?
first question. What's the rave about it?
Yeah,
What is all about this GLP-1 medication that almost everyone is talking about
yeah.
it? I mean, how
So
long has it existed there? It seems like in the past 2 years it came to light, but I think it's been, I mean, these medications have existed for some time. So tell us a little bit, like,
yeah, so GLPs or glucagon-like peptide, that's what that stands for, agonists, they've been around for decades for diabetes. And so we always use them for diabetics, but then as they were studied and as patients reported, they also had a beneficial side effect of weight loss. And so initially, many of the drugs like Ozempic and Mounjaro, which is newer, but those were approved for type 2 diabetes. But then in the last couple of years, we have seen FDA approvals for weight loss. So uh, we have cousins, that's what I like to call them. So we have Ozempic, which is approved for type 2 diabetes, and then we have Wegovy, which is approved for weight loss. And then we have Mounjaro, which is approved for type 2 diabetes, and its cousin Zepbound, which is approved for weight loss. So those cousins, as I like to tell them, call them to my patients, they're the same drug. They're just FDA approved for two different reasons. But yeah, they've been around for quite some time. It's just they haven't been used as widely for weight loss until the last couple of years. And, I think the internet and social media has really caught wind of it too, which has amplified their power even more because now people know that they actually have a weight loss drug that consistently works in most people. Now, there's always going to be some non-responders, but for the majority of people, they're revolutionary when they need to lose weight. They turn off that food noise, make you feel more full.
Mhm.
And now we're seeing cardiovascular
Yeah,
benefits, and it's being studied
difference.
for all different things. I think they really are one of the biggest drugs to hit us this century. Kind of like the way that statins revolutionized things. I think this is the next big thing, and we're
Yes.
celebrating them appropriately. We just have to use them
Yes.
appropriately too.
Wow.
Yeah, but that's what the rage is. I do think that this is one of those things that is not just a trend. It's not just a fad. I think they're going to be around for a
Oh,
long
wow.
time,
Wow.
used in different specialties to prevent and treat different types of diseases. So I think we're just, scratching the surface when it comes to the possibilities of what these drugs can do.
Okay. Now, so what you said Zepbound and Wegovy for weight loss, then
Hmm.
Ozempic and Mounjaro for type 2 diabetes.
Correct, correct.
Okay.
Yep.
So based on that, what about so now? So when these medications are being prescribed, are they prescribed like Ozempic, Wegovy, or they look for the generic names, like this compounded medication? Because
Yeah.
that's the whole.
Yep. So when you're getting an FDA approved medicine, you do want to look for that brand name. If you're going to use a compounded version, then you would be looking for semaglutide or tirzepatide if that's available. But patients traditionally have gone both routes. We know a little bit more about the way that the FDA approved medicines work and
Okay.
um, compounds, though, I think they have their role when we're not able to get the FDA approved medication. So it's just a different process of actually making the medicine and the governing bodies that regulate kind of how the medicine is made when you talk
Mm-hmm.
about FDA approved versus compounded. But when you are looking for an FDA approved medicine, I would look for the brand name. And confirm that with whoever is prescribing your medication. Otherwise, I would assume you're on a compounded version of it.
And in terms of efficacy in both of them, do they is anyone stronger, the FDA approved ones versus the compounded ones?
I don't think it's not comparing apples to apples, so we just don't know.
Okay.
Now, have I had patients come to me and have great results on compounds? Yeah. But have I also had some patients say, oh, it didn't work for me? And I'll say, okay, well, that doesn't mean the FDA approved one won't. So it's not quite apples to apples because we don't have the same data on both sets. But when you're getting the FDA approved medicine, there is a little bit more data, especially to compare semaglutide, which is Ozempic and Wegovy, versus tirzepatide, which is Zepbound and Mounjaro. So Zepbound and Mounjaro, 20% weight loss on the regular. For most people, that's the average weight loss after several months of use. Ozempic and Wegovy, those can achieve that same degree of weight loss, but we're talking more in the 10 to 15%. But certainly you can also achieve 20% with Wegovy and Ozempic. We just don't, so for compounds, there's so many pharmacies out there that are doing different
Different
things. And
things.
so, yeah, like I wouldn't say that one compounding pharmacy is the same as the next one. So we just don't know. But I think for the right population of people, it may be an appropriate answer for them. But yeah, we can't compare them to FDA approved.
Compare them
Yeah.
to FDA
Yeah.
approved. Okay. So you would say the FDA approved one for sure. Like,
I think
if
you
a
know what
patient
you're getting.
mm-hmm,
Yeah, it's a more of an assurance that it's been well studied, but that doesn't mean that there is no rule for compounds. It just means that we just don't know enough
just
about
don't
them
know
and where, yeah.
about there. Got it. Because I know a lot of people on the compounded ones.
Mhm.
And when they come to me, they tell me they're on the compounded ones. And I'm like, okay.
Yeah.
So specifically, yeah.
Yeah.
So is there, because now you told me already that Ozempic and Mounjaro is for type 2 diabetes, Wegovy and Zepbound is for weight loss. Now, so are you trying to say that Wegovy and Zepbound can be used for type 2 diabetes?
Yeah, they could be, but they're not approved for it. So
They're
if you're
not
looking
approved
for
for
your
it.
insurance to cover it, they would preferentially pick the GLPs approved for type 2 diabetes, and that's based on their indication.
Indications. Got it.
But it doesn't mean that it won't treat it. It just means if you're looking to get it covered by your insurance,
Got it.
then you want to get on the right medicine with your doctor. Yeah.
Got it. So
Yep.
okay, that makes a lot of sense. That makes a lot of sense.
Yeah.
Okay. Um, so is there out of all these ones, is there anyone that has lesser side effects
Yeah.
than, patients are
So
able to tolerate more?
yeah, so I think that in general, it's very person dependent, but for the most part, what I've seen is that the tirzepatide or Zepbound and Mounjaro, they tend to have a little bit less side effects, but overall, I think all of the drugs are pretty great. Like you might have some nausea or some acid reflux, but usually your body will adjust to that over time. And if you're on the right dose, you don't have any, like hardly any side effects at all. Like if you're chronically nauseous or vomiting all the time, you're probably having a specific situation happen where you either want to discontinue the medicine or reduce your dose. But nobody should be living with, just nausea to the point where they can't eat anything, they're vomiting all the time, or they're so constipated that they're developing some complications of that. So it's about the dosing. And if you're on the right dose, your body will adjust to it. Yeah.
Okay. So I have a question that was asked.
Mhm.
So, hey doc, I had pancreatitis in the past and now was prescribed,
Yeah.
one of these GLP ones. I thought pancreatitis was a contraindication.
Right. So they have been linked to pancreatitis, the GLP drugs. That being said, it's extremely rare. So if you had pancreatitis due to a GLP, especially recently, I wouldn't go with it again because you're at risk of pancreatitis again. If you had pancreatitis due to, let's say, a gallstone, a gallbladder related issue, and your gallbladder was removed, it was taken care of, the cause of the pancreatitis was taken out of the equation, you're probably better off in that scenario than if the GLP caused it. So I would say it depends on what caused it. Like, was it alcohol, right? Alcohol is another big cause of
Mm-hmm.
pancreatitis. And if you're no longer drinking, there may still be a small risk of pancreatitis, but it's not the same as if the GLP directly caused it.
Got it.
So I would just say that it would depend on the cause of the pancreatitis and how that was managed.
Okay, now they didn't specify that. They just said in the past,
Yeah,
pancreatitis in the past.
yeah, yeah.
They didn't really specify that. Okay, okay, so that's good. So now let's get into the main issue now. So we're trying to connect, have a direct or indirect relationship between medications and hair loss or hair health, okay, directly or indirectly. So have you seen in cases some of your patients or clients coming in with complaints of hair loss or hair shedding,
Yeah.
or complain about, hey doc, I think this medication is making me lose my hair more.
Yeah. Sometimes they do.
Mm-hmm.
Oftentimes, we're always checking in about their symptoms, so we try to catch these things before they even occur. And what I mean by that is we don't want rapid weight loss. So whenever someone is losing too much weight, let's say they're losing, 30, 40 pounds a month, which shouldn't really happen unless you've got this, I mean, it shouldn't really happen. We're going to try to slow that down ahead of time, because anytime you have a stressful event, right? And I'm sure you see this in your practice, stress can
Yes, stress.
cause a shock, right, to the hair follicle and create, a scenario where all the hair follicles start to fall out
Yeah.
rapidly.
Mm-hmm.
But for most people, fortunately, it is a phase and they'll get through it, but it is very distressing, right,
Yes.
to be like losing clumps of hair at a time.
Okay.
But to answer your question, yeah, they do come to me sometimes with it. And then we'll take a close look at, well, how quickly have you been losing weight? Is it causing too much stress to your body? And that's usually the first thing we'll look at. Obviously, we want to make sure that they have well-rounded nutrition with protein and their vitamins
Mm-hmm.
and all that if they need to, because if you're not eating that much, right, you have nutrient deficiencies and you've got protein
Mm-hmm.
deficiency. And so, again, I try to get ahead of that with my practice so that that's not even in question when they come to me, because when I start someone on GLP, there's a lot of education that, hey, just because you're not hungry doesn't mean we're not
Yeah,
going to
then,
eat. We
again.
still need to fuel our body with the nutrition it needs to make things like our hair, nails, our hormones, all different things that depend on nutrients, right? So if you can address that ahead of time, you're in a way better position.
Okay.
But the hair loss, I would say, is usually caused by just rapid weight loss.
Okay.
Of course, you can do your due diligence and make sure their thyroid is okay,
Mm-hmm.
make sure there aren't other hormonal
Okay.
influences going
Just,
on. But for the most part, the first thing you do is you take a step back and you say, well, how much weight have we lost? Is this a little bit too fast? Should we slow it down?
mm-hmm.
And then reassure the patient that you're going to work with them on it, and make sure that you take a close look at their diet. This isn't going to turn around overnight. And then if it's still an ongoing problem after correcting those things, maybe they need to see you, or they need to see a dermatologist or
Mm-hmm.
someone, hair expert,
Mm-hmm.
to figure out what can be done to support them if the hair loss continues.
So, excuse me. So you're trying to say that you see more of hair loss or hair shedding, more with rapid weight loss.
Yeah.
Okay. So what is the recommendation based on that? Like if they're having rapid weight loss and they're having hair shedding, are you going to reduce the dose you're taking or increase the protein they're taking? So what is usually your first line? What do you do?
The fastest thing, I mean, you could do both. There's nothing wrong with doing both.
Mm-hmm.
But definitely, if it's too rapid of weight loss, let's say you're losing 5 to 10 pounds a week and that's too fast, yeah, reduce the dose for sure. Because if you can't eat more to counteract that dose, then you should reduce the dose, right? You're on too much. And then protein, yeah, look at it. If you're already having 125 grams of protein a day, I'm not going to tell you, okay, we'll eat 200. That's not realistic, right?
Yes.
That's for most people, that's just a lot of protein, and
Mm.
then we could have other problems.
Yeah.
So yeah, I would optimize the protein first and reduce the dose of the medicine if the weight loss is too rapid, because if you're experiencing hair loss, chances are you're constipated or you're having
Mm.
nausea or some other side effect. So why not get on the most appropriate dose for you? Because not all weight loss is a good type of weight loss, meaning fat loss, right?
Mm-hmm.
So we don't want to be losing muscle, which requires protein, right? So it's all kind
Yeah.
of related, right? So there's a difference between fat loss and muscle loss.
Mm-hmm. That's right. So what is the recommended amount of weight to lose per week or in a month?
Yeah, I mean, you can think of this in terms of pounds, 1 to 2 pounds a week. Even 2 pounds for a lot of people depends on your weight, right? 2 pounds for someone that weighs 170 pounds is different than 2 pounds for somebody who weighs 370 pounds, right? So percent wise, I would say roughly, 4% per month. So 1% per week. If you want to do a percentage rather than number of pounds lost, that's another way of looking at it. Generally speaking, when you're first on a GLP, you do lose a lot of water weight. And so the first month, you may have what I call like a whoosh effect, where you lose a bunch of weight. That can actually be normal. And then things tend to be more steady after that.
Okay.
So it's kind of looking at the whole picture and saying, okay, well, maybe we lost 6 or 7% of our weight the first month, but then month 2, it slowed down
Okay.
to 3 to 4%. That's okay. So it just depends on your response to the medication and if it's appropriate and safe for you or not.
Okay. So now I'm going to give you two scenarios. This is personal scenario that,
Okay.
client wise. So I have this client, morbidly obese. I don't know if we're supposed to use that word now, but like, on the heavy side, like really
Sure.
heavy side, we're talking about 400 pounds. Now I have this client that's like 200 pounds, both of them on the same medication. The client that is 400 pounds is losing a ton of weight, but he still thinks he's not losing enough weight based on, because he's 400 pounds. His goal is to get to 200. So
Mm-hmm.
when you tell him coming in with hair shedding or hair loss, tell him, hey, you need to slow down. We need to reduce your dose. And he's saying no. Like, because he's 400 pounds and he's saying, I'm 380 or I'm 340. Like, that's not enough. It's not noticeable. So I can't reduce the dose.
Yeah.
Versus the person that is 200 pounds, that is okay, saying, okay, doc, it's okay for you to reduce my dose because I'm having hair loss or hair shedding. It's okay for you to reduce my dose. So I've had problems with that,
Yeah.
like when to compare the weight
Yeah.
wise. So what do I do in terms of that? Like, how can I, overcome that, especially with clients of mine, especially the ones that are really morbidly obese?
And they're getting the medicine from somewhere else.
Yes, not from me.
So,
Yes.
yeah, I would definitely work with them to talk to their doctor or prescriber about, are they on the right dose? Is the doctor expecting this amount of weight loss or not? And I think for a lot of people, weight is very tied to their identity,
Mm-hmm.
and it's a very emotional thing. So sometimes when we try to tell someone to do it the right way and do it the way I say, they don't want to
You don't
listen.
want to
So I would just be
listen.
supportive and say, hey, you're doing great things, but
Mm-hmm.
maybe this journey is going to take you a little bit longer to do it the right way,
Mm-hmm.
than the rapid weight loss. Because with rapid weight loss, it doesn't just affect our hair, it also affects things like we're more prone to gallstones, right? We're more
Mm-hmm.
prone to having complications like that. And so it's not always the best thing for us to lose weight rapidly. And maybe you want to talk to your doctor about the appropriate dose.
Mm-hmm.
Um, and then maybe that'll give them some insight as to where they're getting their medicine. Are they even talking to someone about it? Because if they're not, to me, that's a little bit of a red flag, because these are very powerful drugs and they need to be managed appropriately. So
Mm-hmm.
it's very possible that they're in the driver's seat and they think that the more the better, the more weight loss, the better.
Weight loss,
And it
yeah.
can almost be addicting to see that weight go down every month, rapidly. So
Mm-hmm.
then when you only lose 5 pounds, you think there's a problem, but really that's actually the safe amount to lose.
Mm-hmm.
Not saying the person that weighs 400 pounds needs to only lose 5 pounds a month, but what I'm saying is, sometimes they just get used to losing so much weight and they don't want another
You
option.
don't want an option,
Okay.
yes, because that's really the problem. Because
So,
they're happy they're losing the weight.
yeah,
I
but
mean, I'm happy for
it,
them,
it,
but
it
now
requires counseling, a lot of counseling. And I
love
would, I would
counseling.
definitely take a peek into who's prescribing it,
Mm-hmm.
what kind of care are they getting. Maybe the person prescribing it isn't aware that, of
This is what's
this
going
amount of weight.
on.
Yeah,
Mm-hmm.
so I would just encourage them to go back to that person or figure out if it's the right type of program for them,
Mm-hmm.
because really you want comprehensive care. You don't want, someone that is not looking at what's happening to
Looking
you
at.
and monitoring. Yeah.
Mm-hmm.
Yeah.
Someone that's going to factor in your hair all around
Yeah.
your health.
Yeah, exactly.
Got it. Okay. So is there, apart from rapid weight loss, is there any other warning sign that should indicate for the physician to stop the medication, or kind of, tell the patient we might need to, reduce the dose? Is there kind of any other warning signs or we need to look out for?
Yeah, rapid weight loss, nausea, like severe nausea to the
Severe
point that,
nausea.
you can't eat, you're queasy.
Mm-hmm.
You should be able to, if you're working or staying home, do your job all day. It shouldn't be something that is keeping you on the sofa, or, you've got to take in anti-nausea medicine around the clock. Like that should not be how you are living your life. It should be in a very manageable way. So too much nausea, too much constipation, I see sometimes because we're slowing down the whole gut, right? So
Mm-hmm.
everything is passing through slowly. So your chances are going to be constipated if you're not intentional about water and fiber. So if you've optimized water and fiber, but maybe your patient has IBS, like irritable bowel, and they tend to get constipated no matter what their diet looks like. For that person, I would strongly consider reducing the dose. And if they have any severe symptoms like severe abdominal pain, where they need to get checked out, in person, that would be another reason to just stop the medicine.
Stop the
Yeah.
medicine. Okay. So what about diarrhea? In cases of diarrhea, do we have
Mhm.
symptoms of
Yeah,
diarrhea?
I usually don't see too much diarrhea. Usually it's constipation, but sometimes diarrhea can be a sign that you're actually really constipated. So, taking a good
Mm.
history to figure out, are you having mixed, diarrhea, constipation,
Sure.
or is it pure diarrhea?
Mhm.
That makes me think of a patient that had the lowest dose of one of the GLPs and immediately had
Mm.
diarrhea, couldn't tolerate it, no matter what they did. So they stopped it because it was interfering with their life, and it wasn't worth it, to do that. So it's not as common, but it can happen.
Okay.
Again, we're working around the gut, so
Okay.
everyone's gut will react a little bit differently.
Okay. So I'm going to throw a trick question to you. I always throw this trick question to everyone. So this is trick questions mean random questions that I see online
Okay.
that I want to ask you so that you're the expert. So we have to ask you. Now I see all these ads that say apple cider vinegar is compared to the GLP ones that you have to mix 2 teaspoons of this with water and this, that you don't have to go on the GLP one. So how true is that?
They're not a comparison. That doesn't mean that there is no benefit to apple cider vinegar, and
Mm-hmm.
perhaps we need a study to determine exactly how
Mm-hmm.
effective it may be.
Mm-hmm.
I think the idea behind the apple cider vinegar is to just help stabilize your blood sugar,
Mm-hmm.
right, and help you not absorb help your blood sugar level stabilize. Um, GLPs do that, period. They do it. That's what they're good at doing.
That's what
So
it is.
there's no comparison. I mean, it's just
Okay.
there's no comparison of a medicine like GLP compared to apple cider vinegar. Again, it doesn't mean that, a teaspoon of apple cider vinegar and, 12 ounces of water here and there, not all day, is bad for you. It just means that I would not expect 10 to 20% weight loss doing that every day. I just
Okay.
wouldn't. I would not. I've never seen a study to support that.
To support that. So
Yeah.
there's never been a comparison between apple
Not,
cider vinegar
not that
and
I'm
GLP.
aware of, no.
Got it.
No.
Okay. So another question is, this is not a trick question, this is just a question. So if someone is dealing with hair loss or hair shedding, comes to the clinic wanting to lose weight, do you factor in the hair loss, or you just go ahead and start the medication and kind of monitor it? Well,
If they already have hair
yes,
loss.
or if they're dealing with that, yes.
Yeah, that can be tricky. And again, a lot of counseling to tell them that, hey, if this medicine works rapidly,
Mm-hmm.
even on the lower doses, you may experience some more hair loss. But getting a good history on, what was the cause of the original hair loss?
Mm-hmm.
Did their primary doctor look into that already? Have they seen anyone for it? Or maybe if it's severe enough, maybe they need to pause, get a workup for that, and then come back to the weight loss, because chances are if they lose weight rapidly, it's going to get worse. But again, it kind of depends on the history of what caused the original hair loss.
Right.
Was it weight loss? Was it nutrition? Was it genetic? And then, seeing if it was appropriately
Okay.
addressed. If not, maybe address that. And if it was, and this is where they're at, and they want to lose weight because that's what's important to them right now, just a lot of counseling that they may lose more hair. And it may be temporary, it may not be, but we really need to kind of get to the underlying cause of, what caused their weight loss
What
in the
caused
first place, or their hair
the
loss.
hair loss? Sorry.
Yeah.
And it was, so it's not a no, it's not an absolute contraindication not to start
No, it's
before.
not. But I would just, for the patient's comfort and for the patient to not feel like you were keeping some important information from them, I would be transparent and say, hey, this is something that you might deal with on top of your original hair loss.
Okay. But so have you had patients that come in with complaints of hair loss even before starting the medication, like put it in their medical history, like, you
Yeah.
know?
Um, I can't think of anyone off the top of my head.
Mhm.
I've had people ask questions about it, and
Yeah,
so that's where the counseling will
yeah.
happen. I can't think of anyone recently that's come to me with that, but definitely some people do have questions because they read about it online
Yeah,
and they're concerned. Maybe they have thin hair to begin
yeah.
with, and they're just concerned about losing, from their baseline.
I
Yeah,
can tell you almost half of my patients coming they're on
really,
GLP-1 medication.
really.
Like more than half of them come in, and that's their question number one. Like, you know, they're afraid of gaining weight, but they're losing hair. So it's almost like I have
Yeah,
to fight this battle I have to have this balancing act, like,
yeah.
you know,
So do you
which
find yourself kind of doing a lot of counseling around that?
yes, I do.
Yeah,
I
yeah.
do. It doesn't really have it, and like you said, medical history. And I always tell my clients to have a hair diary. Kind of
Hmm.
when did they start the medication? Are they losing chunks of hair? Like, you know, a lot of hair when they comb it. And sometimes we can also tell them to, you know, keep the hair in Ziploc bags and kind of monitor it and
Wow,
see,
okay.
like, you know,
Yeah.
if it's progressing
Hmm.
or not. You see, that's
Hmm.
the only way because I'm not in the person's house. So
Yeah,
that's the only way I can see,
yeah,
you know, put it in Ziploc bags and kind of every day. You
yeah,
can do that. You can do that every month, whichever one. So that's the only way I can know because sometimes we can count it
yeah,
or sometimes it's visible. You can see there's a difference that this one is like it's getting progressively worsened. So
hmm,
you can do that. So I really get a lot of questions on GLP-1. And also, especially when I want to do a hair transplant, people on GLP-1, I can tell them to stop for a week before I do the hair transplant, you know, because that you're already doing something that's making you lose weight. Then you're going to do a hair transplant, which is more trauma to your scalp. And
yeah,
we can
yeah,
skip a day.
yeah,
We can skip a week,
yeah,
like, you know, just to kind of get the hair transplant. Then you can continue your medication. I tend not to stop it for a long time
yeah,
because they really need it. There's a reason
yeah,
for it. So I tend to almost all my, that's why this is so
yeah,
important to me. I'm like, I need to
yeah,
ask all the questions because I get a lot of questions
yeah,
on it. That's number one. Once I tell them what medication are you on, Wegovy,
yeah,
Ozempic. I'm like, and I actually have a client that comes in. When anytime she comes in, she has to weigh herself. She has to weigh herself. It's like, I don't want to, because some of the medications that, you know, that we also place the patient on, we also have to be careful. Like, you know, if they're trying to lose weight, to make sure, you know, they are adequately hydrating and
yeah,
eating. Because if you place someone on minoxidil, that can drop your blood pressure and you're not eating,
yeah.
you know,
That's a
they start
recipe for,
becoming dizzy,
yeah,
then that's a problem for me. So these are the kind of the battles I have to, you know, kind of think about each client when they walk in. So have you noticed an increase in hair loss or hair shedding among patients that are on GLP-1? Have you noticed an increase or is just same amount, let's say 50% from 50 to 70%? Can you kind of give us a figure, like, you know, in percentage?
percentage of the patients that
Yes, like, you know,
experience
have you
it.
noticed an increase
Yeah.
in hair loss, even if they didn't complain about it?
Um,
Now they're complaining about it.
yeah. So I honestly think I do a lot of prevention and counseling. So
Okay.
before they even start the medicine, we are talking about body composition, preserving their muscle, which, by extension, you're focusing on how much protein you're eating, your nutrition. I'm not giving out these drugs without appropriate counseling. So I actually find that a lot of my patients don't experience significant
Oh,
hair loss that they're
good.
bringing it to me.
Nice.
I'll ask them, and sometimes they'll say, "Oh, yeah, I am having a little
Nice.
bit more hair loss."
Nice.
But typically, that's in someone where they are losing a little bit more than we'd like them to, or the upper limit, I call it.
Mm,
So maybe they were losing 4 or 5% a month, but for them, that was enough stress on their body to lose the weight, to lose the hair. Um, Other people, they can lose 4, 6% a month and their hair is okay. So everyone's body reacts to this amount of weight loss differently.
mhm,
But for me, I really try to minimize side effects by appropriately dosing and
mhm.
prescribing the medicine and appropriately counseling them on everything, their
Okay.
exercise, nutrition, their sleep, and their stress management. So I have a very unique way of practicing. It's not
Okay.
very common, I would say. Most obesity medicine certified doctors practice similar to me, where it's not just about the pure weight loss. So I think if you
Mm,
spoke to someone, who's not doing this as their main
And their
focus,
main
and
focus,
they're
yeah.
doing it on the side, and maybe it's just a different model and they're not able to provide counseling.
Mhm.
Those individuals, I'd be curious to know, how are their patients doing with regards to severe side effects and how are they managing it? But to be honest with you, a lot of my patients don't experience significant hair loss where they're like, I've got clumps of hair coming out, because we try to get ahead of it.
Ahead of
We
it.
try not to get to the point where we're losing too much weight in the first place, which is usually the reason that they're losing hair if they're going to.
Got it. So you
Yeah.
tend to do, you
Less
try to
less than
prevent.
10%, I would say, honestly, for my
Awesome.
patient
But that is
population.
good. But that is
Yeah.
good. That means they
Yeah.
have to refer my clients to
Yeah.
you. The ones that are in
Yeah.
Arizona, they have to come to
Yeah.
you then.
Yeah.
Because that's what I want to see. Like, if they're not dealing, if it's less than 10% is actually a good, like, is really good.
For
I mean,
significant hair loss. I
mhm,
mean, if I ask them, then they might say, oh, yeah, I've been losing more in the shower, or when
mhm,
I brush my hair, that's when I notice. But I don't have people regularly coming to me saying this is a big problem. Usually it's the nausea and the constipation. That's what's really bothering them.
mhm,
That's what they're going to notice on a daily basis. But sometimes they're not paying attention as much as they should. But the good news is they're not losing so much hair that they're emergently calling me about it,
calling is how much.
typically. Now,
Got
I
it.
think that if you are on a medicine, and you're getting it from somewhere that they're not monitoring you, you're probably more prone that this
From
is happening, so that you have to be vigilant, and you've got to, talk to your hair transplant doctor, talk to your prescribing
dermatologist.
doctor, yeah, about what you can do to slow down the weight loss or figure out what the cause is. Yeah,
Okay.
that's the most important thing, is that communication.
Okay. Oh, that's really insightful. Okay, so I mean, I think you kind of went through because my last question was supposed to be, what advice will you give to people dealing with hair loss or hair shedding while on the medication?
Yeah.
And you're trying to say your advice is that go to someone that is board certified, that knows what they're doing, that practices obesity medicine and lifestyle and all that, like what you said, so that they can give you the right advice and right counseling. I mean,
Yeah,
those are.
ideally it's about that time and having someone listen to your personal
Mhm.
history and figuring out, is this GLP related? Maybe, but also look at what else it could be. Is the hair loss coming from somewhere else?
That's right.
You never want to feel rushed. You want your doctor or prescriber to listen to you and understand your unique situation, because none of us are identical. We all have our own path that we're on. So it's just important to go somewhere where they have the time to talk to you about your history.
But what about in cases of now people are prescribing online and they ship the medication to you? In cases of that, what is the recommend? What do you recommend? Like, what is the
Yeah.
recommendation towards
I
that?
mean, I prescribe online as well,
Mm-hmm.
and I don't think that should be a barrier to
Mm-hmm.
communication. We fortunately we live in a digital age now where
Yeah.
we can have Zoom calls, or we can have patient protected
Okay.
calls online that are video.
Okay.
So it could be just like we're in the doctor's office.
Mm-hmm.
That shouldn't be a barrier in this day and age. You should still be able to talk to your doctor. Maybe it's a phone call, maybe it's a video call with some regularity, or be able to get in touch with them if there's an issue. If you're not able to get in touch with someone, then I think you have a bigger issue.
Bigger issue.
Yeah.
Got it. Got it.
Yeah.
Okay. So
Yeah.
at least they need a consultation with
Yeah.
someone, like,
Yeah,
even if it's virtual.
consultation and monitoring. The
Monitoring.
monitoring is key. What I do is body composition, so I'll measure specifically how much fat loss they have versus muscle loss, because like I said before, it's not all the same,
Mm.
right? So if you lose a bunch of muscle, that's not helping anybody, right? You want to lose fat loss, and it's important that we use that language more. It's not just weight loss, it's fat loss, right?
Fat loss.
Yeah, fat.
So muscle loss is part of it though, if you lose it. But
Yeah, it can be. It can be, but it doesn't have to be, right? If we're very intentional about what we're doing, so what we're eating, right? Protein, everybody's talking about that. And how much exercise are we doing in terms of lifting weights and resistance training? Those things help us preserve and build our muscle mass. And I talk about that all day. So it's really about preserving or gaining muscle if you can, and losing fat, and that visceral fat, which is, by our organs. That's what I really care about, is that's the inflammatory fat that we don't want, that can cause problems, right?
yeah,
So it's the type of weight loss matters. So if you can monitor that with your doctor, that's great. You can also buy a body composition machine for yourself at home. Um, Amazon sells them. InBody sells them. I'm not affiliated with anyone, but you can buy these things at home and monitor. And the best way to do it is to take your muscle mass and fat mass ahead of time. So before you even start on the medicine, get a snapshot of where you're at. That way, as you progress, you can monitor it. And so most obesity medicine clinics will offer that type of evaluation, but if your doctor doesn't or wherever you're going doesn't, you can get a scale like that at home.
Okay, so there's a scale for that.
Mm-hmm.
Okay. Okay, so with this body composition, our goal is to watch out for the fat and the muscle mass.
Exactly.
And and if they're losing more muscle mass, then
Yeah, if you're losing a lot of muscle, like it's different for every person. You definitely want to go back to the drawing board and figure out, why am I losing so much muscle? What is it? There's different things that go into preserving muscle, but the mainstays are the resistance training and the protein. But maybe this patient is perimenopausal and their estrogen is going down, right? So there's different things that can happen.
that's right.
But you don't know if you're not looking, if you're just on the medicine without monitoring, you have no idea, right?
Okay.
So the knowledge is very important. Understanding what your body composition is
Okay.
before, during, and after these medicines, I think would be that might be my biggest piece of advice is,
Right.
monitor your body composition, and then also have some prescribing doctor that knows you and has time, for you.
Okay. Awesome. Okay. That was really insightful. I mean, you've told us a lot. I mean, I've been writing. So I've been
Good.
writing
I'm
as you're talking.
glad it was helpful.
Yes, it was really helpful. So in summary, FDA approved, you tend to, prefer the FDA approved ones, and their specific approval for either diabetes or for weight loss. And you have to also not just the medication. I'm just trying to recap everything you've said so that you can agree or not with
Yeah. Oh,
me.
yeah, I'm agreeing.
So
Yeah.
yeah,
Yeah.
so if you're having rapid weight loss, I think it's time for you to reevaluate the dose
Yeah.
and reduce it. And most of the times, what we need to watch out for is severe symptoms, the severity of the symptoms they're having.
Yeah.
And they need to reevaluate also the dose, rather to stop it or something like that. Yeah. And pancreatitis, you said, is based on what caused the pancreatitis. So
Mm-hmm.
if it's caused by the GLP-1 med, then it's not an ideal situation to continue
Right.
the medication. But if you had it in the past due to gallstones or something else,
Yeah.
then then
Then it
then
might
that's
be okay. Yeah.
it might be okay. Then with hair loss or hair shedding, either the person has already been dealing with hair loss or hair shedding, then the medication actually might have made it worse due to aggressive weight loss. So typically, you don't see it's less than 10% in your clinic, according to what you said. So, but if the person is losing a lot of hair, it might be something else that's going on too.
Yeah.
So we need to think about
Yeah.
that. I think that's really sums it up. Thank you so much. Do you have any other advice for our audience? And
Yeah.
any other advice for our audience?
Yeah. Just, keep, your health at the forefront of your mind, and,
That's right.
don't let anyone shame you for making choices about your body that are evidence-based, whether it's for your weight, your hair, whatever it may be, you're doing the best you can, and just keep going, consistency over perfection.
Consistency, that's right. And how can someone find you once again? Find you once again. We cannot live without saying that.
At Dr. Mona Sodi is my Instagram,
Mhm.
and monarchconciergewellness.com is my website.
Mhm.
I do free video consultations
Mhm.
to see if we're a good fit to work
Mhm.
together. So
Mhm.
if you're in Arizona, Pennsylvania, or Georgia, I'd love to meet you.
Awesome. And you also do virtual too. So it's free,
Yeah.
right? That's what you said, free
Yep.
virtual consultation, which is
Exactly.
good.
Yep.
Yes. So
Exactly.
nice meeting you, Dr.
Yeah.
Sodi. Thank you so much for all the wealth of knowledge you've given to us today.
Of
And we're
course.
going to keep in mind next time when I meet the client I was telling you about, I'll know what to tell them. I'm actually going to write it down now, what I'm going to tell them,
Awesome.
to make sure actually what clinic are they going
Yeah.
to make sure, they're seeing the right person. and to make sure like this is not healthy if you're losing this amount of weight in the space of time that we talked about.
Yeah.
So I'll definitely, do that.
Yeah.
Thank you so much.
Oh,
Thank
you're
you for
so
coming
welcome.
on.
Thanks for having me.
Welcome.
I
Thank
loved
you
our
so much.
discussion.
Bye. Bye
Bye.
bye.